The Doctor, Episode 001, about Dr. Emily Porter, sexual health, wellness, platelet-rich plasma, PRP, the O-shot, Priapus shot, gains wave, testosterone, libido, and bioidentical hormones.
This is Dr. Charles Reynolds, inventor of the O-shot, and thank you for joining Dr. Emily Porter, the Austin Love Doctor, as she openly discusses your most intimate questions regarding relationships, sex, and personal wellness through the eyes of a medical doctor who treats men and women for a variety of sexual issues using the latest medical advancements available. Get comfortable, relax, and welcome your host, Dr. Emily Porter.
So I'm Emily Porter. I'm a physician in Austin, Texas, and I'm the Austin Love Doctor. And I would just like to introduce myself. So I'm a mother of 4 children. I had 4 kids in 4 years and 2 months, which means I got pregnant on the honeymoon and was pregnant for 5 years, essentially, until my first kid entered kindergarten. And they were all vaginal deliveries, some with epidurals and some without. And one got stuck and, 2 got stuck and one had a broken clavicle, and it wasn't all fun, but I love my kids and love my husband and have a great family. But I had all my kids, and then I was working as an ER physician for about, 11 or 12 years, I think. I kind of always, I think I ended up in the emergency room, not really sure how. So I was sick when I was a kid, and I had almost died. I had an appendectomy that went really, really badly. And they ended up having to do emergency surgery on me, open me up, and I had a colostomy, which is a nice way of saying you poop out of your stomach at 9 years old for like 3 months of that, and then had it reversed. But so I knew I wanted to be a doctor always because I had a really shitty surgeon that almost killed me. And at 9 years old, I knew I could do a better job taking care of people than he ever could. So that was always my goal, was to go be a doctor. And I thought I wanted to be a reconstructive plastic surgeon, actually. Because I thought that would be really, really rewarding. And I'm talking about like fixing people who are very broken and are very self-conscious about how they look because they were burned or they were mauled or by a dog, or they had issues that needed reconstructive surgery. And there was a lot of psychological component to it. So I went to medical school with the idea that I would go be a reconstructive plastic surgeon. And they always kind of joke, my family always joked about, I would do their Botox for them too. I had melanoma in college, and so I toyed around with being a dermatologist for a little while. So I always thought I would do something sort of in aesthetics. And I went to medical school, and it turns out I hate surgery, which was kind of a upsetting thing because now I had to rethink the whole plan. And it wasn't that I don't like surgery. I think it's fascinating. And I still go, and I volunteered a couple years ago in Guatemala and helped kids with cleft palates. And it was amazing to be in the operating room and see the surgery. What I hate is the operating room. It's like you get in there and you spend like 30 minutes scrubbing your arms and your hands and put these gloves on. And the second you get in there, you have to pee. And you're like trying to squeeze back a fart because it's like, it's just so uncomfortable, and you have no idea how long you're going to be in there. And you think it's going to be an hour-long surgery, and it ends up being a 4-hour-long surgery. And I just really never got comfortable in the operating room. So that kind of threw out a lot of specialties. It threw out reconstructive plastic surgery. I could have probably been in a surgery center and done boob jobs for a living, but I didn't think that would be gratifying enough. And dermatology, I just thought was too boring. When I actually did it, I was like, I can't just look at moles all day and come up with 10 different adjectives for the word brown to describe a mole. It's like, it's a brown circle. What more do you need from me? So I kind of left. I toyed around with psychiatry for a little while. I thought I'd like psychiatry. I really liked crazy people, like acutely psychotic people in the ER. It was always fun just to try to figure out how those ideas got in their head. It was kind of sad, but it was kind of fun at the same time because you really can't make that stuff up. But I didn't like outpatient psychiatry. And anyway, round and round, went around with a bunch of different things. And I ended up deciding that I liked enough of everything to do emergency medicine. So I did that for a decade, and I literally worked in some major big cities. I worked in New York City. I was in Seattle. I was in Baltimore in the trauma center. I saw it all. Really busy ERs. I worked in some rural ERs. Moved down to Austin and worked at a academic center and then some community ERs. And did that for, 11 years or something. And then unfortunately, corporations sort of took over, and they kind of started to tell you how to practice medicine. And they told you how long you could spend with a patient. They actually would track you how long you were going to be in the room with somebody. They could tell if you were in the bathroom. They could tell if you were trying to get something to eat. I went through all 4 pregnancies as an ER doctor, with no paid maternity leave. And I was there up to 39 weeks, working sometimes 24 and 48-hour shifts. And patients got more difficult because online reviews and Google and more demanding, I guess I should say. And it's not their fault. You deserve good care. I think paternalism in medicine was a horrible idea. But I also think experience matters, and that it's not Disney World. They tried to turn medicine into purely a patient satisfaction or customer driven business. And I think that if everyone could do it, then we wouldn't need doctors. We'd just have kiosks, and you could just go, click diagnosis, sinus infection, and get whatever antibiotic you want. And it kind of got that way. And so I just became unhappy, around my children, and sort of the way I was being told to work. And it wasn't good anymore. I didn't feel like I was helping people anymore. I felt like I was giving people drugs that could potentially harm them, like opioids, during the whole opioid crisis, because my job would be threatened if I didn't. Or they would say, I paid a $500 copay and I'm not leaving until I get a Z-Pack. And I knew that was wrong. And I vowed that no matter what I did as a doctor, I would always be ethical. And I would never do a test that wasn't necessary, even if a patient needed it, or even if a patient wanted it, because they wanted it. Anything that could harm. We take this vow, first, do no harm. And I think that doing things that could hurt people or that are unnecessary to make a hospital more money or to make a patient happy when it could be harmful to them is just really bad. And I came to I said, I got to do something else. And I think it was probably after I went to Guatemala and had did that mission trip, because I was like 35 and I'd never had Botox before. And I was there, and it was paper charts, and there weren't all the clicks. The average ER doctor has 40,000 clicks to get through a shift, which is a lot of clicks. And more clicks don't mean better care. They mean more time away from the patient. And we went down there, and it was paper charts, and everyone was so grateful to have physicians there to help them. And I cried at the end. And I'm not a crier. I didn't cry when any of my kids were born. And I cried because it was so powerful, and it was exactly being the kind of doctor that I wanted to be. So I said, man, something's got to change. And all these wives of all these plastic surgeons looked super young, because they might have been 60 years old, but they'd all had Botox and stuff. And so I kind of toyed around with the idea of getting rid of my little angry lines in my mid-30s. And so I did what nobody should do, which is I went and got some Botox off Groupon by an esthetician. But I was scared enough to figure out how to do it first a little bit, so I knew she couldn't screw it up. And I made my friend go first, 2 weeks before me. So if hers didn't look bad, then maybe I stood a chance. And she did my Botox, and that stuff's amazing. I can see why Allergan makes so much money and why it's really a gateway drug. And so I got my Botox, and then 3 months later, now I'm hooked, and I'm like, oh, can you do this forehead for me? Can you do that? And she said, I can. The next thing I know, I'm shelling out like $450. And she wanted a tip, which I thought was just crazy on Botox. But, and then I thought, well, why am I paying this honey who has no medical education to shoot me up? I certainly can figure out how to do this on my own, and maybe I should. So I signed up for a class, again, not probably what you should do, but like a weekend course, and realized very quickly that a weekend was not anywhere enough time to actually learn anything. It just let me dip my toe in the water. And I took my mom with me to Scottsdale because my aunt lives there, and I needed a model to do a Botox and filler course. And my mom was an entrepreneur, and she was a very good role model. Was badass and worked really, really, really hard, and was always there for the important stuff growing up. She didn't miss the county fair. She didn't miss our birthdays. She traveled when she could, but she had a really good example and ended up doing really well for herself and retiring well. And we're on the plane back. And my mom is very much tough love. I love her. But we're on the plane back, and I said, I think I'm going to open a medical spa. And my mom goes, I think that's a fantastic idea. And I was like, I passed the mom test. And she goes, and she can't ever just say that. She had to add a little something. And she goes, now, if you were telling me you were going to try to open a clothing boutique, I would tell you that was a horrible idea. But I actually think that the market's not too saturated, and I think you should do it. Plus, we've been waiting for our Botox now for the last 12 years because you didn't become a plastic surgeon. So I was pregnant, and I got Botox, the second time while I was pregnant, which you really shouldn't do, and I would never treat a pregnant patient. But again, do as I say, not as I do. Doctors are the worst patients. And somehow between May 1st and September 26th, I managed to find a one-room hair salon, buy a $200,000 laser, or finance it just against my income and against my husband's income, and make a call to an ER doctor who was nice enough to kind of give me some advice. Thank you, Bessie McCann. And just kind of do what she did and listen to the laser people and bought a nice laser, which is the one thing that she said she wished she'd done earlier. I took a bunch of classes. I just delved into it and got a bunch of education. And so I opened a medical spa. When my fourth child was like 5 weeks old, inside of a hair salon, I hired an esthetician that worked full-time for me. And then I saw patients. And in Texas, you can delegate procedures to patients after you could delegate procedures to non-medical people like estheticians and laser techs after you've seen the patient. So I was able to see all the new people and do that. Well, one of the things that I did was I learned about bioidentical hormones, and I offered that. And I also tried to offer a couple of treatments that were kind of new and weren't oversaturated, that were kind of trendy, but that I actually believed in, because I don't do anything in my clinic that I don't believe in. Because again, I said I would never do anything unethical in medicine. And that means offering a treatment that I don't think works, or a product that I don't think works. And so one of the things that was kind of coming out was something called platelet-rich plasma treatments. And so the vampire facial, the vampire facelift, the O shot, and the Priapus shot. And also bioidentical hormones. The company was BioT. And so the people at Cyton, that were my laser company, they kind of put me in touch with this guy, Dr. Johnny Pete, down in the Woodlands. And I was going to go and learn about the O shot and the P shot from him, because to go down to Alabama to meet Charles Runnels, who's the inventor, my schedule for the ER was made. There was a schedule conflict, and Johnny taught the procedures and told me to come down and introduce me to bioidentical hormones. And I had a lot of resistance to bioidentical hormones because I think physicians are brainwashed that hormones are bad. We're taught that hormones are bad. Hormones cause cancer. Never, ever, ever give a woman hormones. Don't give her hormones for a minute longer than she needs them. And it's because there was a big hormone study where they used all these synthetic hormones, and some bad things happened to women. And so the FDA kind of shut it down. And anyway, they never teach you the difference between synthetic hormones and bioidentical hormones. There's a big difference. But so I went and learned how to do the O shot and the Priapus shot, and I learned about BioT. And the other thing I vowed when I opened my clinic is that I would be ethical. I would never do something I didn't believe in or that I didn't think worked, and that I would practice what I preach. And I'm not going to lie, I resisted a little bit with the bioidentical hormones. And I don't know if deep down I really was scared. I like to think that I don't know, maybe I was just that brainwashed that, well, they say it's okay, but or maybe I don't need them, right? And so I learned about them and what testosterone in women and what testosterone did for libido to women, and how you could wean people off their antidepressants, and the optimization of thyroid, and how important testosterone was for that brain fog that we all get when we have babies. It's like it never goes away. That mommy brain, it can go away. It's a testosterone deficiency and an estrogen imbalance that happens. It doesn't go away unless you fix it. And so, anyway, I don't know how many months in I got an O shot straight away. And then I started on BioT. And I checked my own levels, and my testosterone was undetectable, which was very sobering. Because I loved my husband, and I didn't want to have sex with anybody else, but I didn't really want to have sex with him and either. And he didn't really push it. And so we just sort of fell into this sort of sexless marriage, not for years or anything, but for like a few months. And I kind of asked all my friends, like, how often do you have sex with your husband? The people who I knew had a good marriage, right? And, women, we do this thing where we ask people a question and then we keep asking until we get the answer that we want. And then we're like, okay, now I got my answer and now it's normal. And so I asked one friend and she's like, I don't know, like 5 or 6. And I cut her off and go, times a month? Thinking, well, I could aim for that. That might be normal. And she's like, not a week, 5 or 6 times a week. And I'm like, okay, you have a hot husband and you're hot and you are not normal. And so I just kept asking until I found people who were in my situation where they would maybe struggle to say a few times a month, right? Maybe once a week would be on the high end. And we all just commiserated with one another. And we all just said, oh, and women, we do this thing where we try to get the answer that we want to normalize things, but we also try to empathize with one another. And that's great. Try to make each other feel good. I love that about women. But sometimes you need to just say, yo, that's not normal. You sound like you have a problem. And what they did was all my friends are like, well, but cut yourself some slack, like you have 4 kids at home and you must be so busy and you work so much. And of course you're tired and you're tired all the time. And I just let myself get brainwashed into thinking that was normal. And whether or not, I don't think normal and common are the same thing. Common, yes. And that's a problem because we need to have a conversation about this in America. The French are doing it. That's why they're all happy. They drink wine and have sex all the time. And women here just drink more wine. And that's only part of the equation. So I checked my testosterone and got on testosterone replacement and got my testosterone, I don't know, around 200, 250. And it was like marriage saving for me. And I got energy again. I have people ask me all the time, how do I have so much energy? How do you do it? Like I'm Superwoman or something. I don't know how you do that. I'm like, well, it's partly just, I'm kind of a gunner, but a lot of it is due to testosterone, and I'm not doping. I don't feel high. I'm not taking, ADHD meds or anything, but having more sex actually energizes you too. And sex felt better again. It was really good again because testosterone helps not only with libido, but it actually helps orgasm. And so does having your thyroid optimized. So here I am with all this testosterone on board, and now I can think clearly, and now I don't have brain fog, and now I have more energy, and I'm not tired all the time, and now sex is better. And I always used to joke about convent mode, right? So when men want it like every, I don't know how many times per hour, it's like 20 times an hour, no matter whether they're getting sex or not, they're thinking about it all the time. I was so stunned to hear Dr. Ronald say in one of his recordings, I think it's the Anytime for As Long As You Want, that he used to, like when he was 14, he would masturbate 4 or 5 times a day. Where are you doing this? I have 2 boys at home, and I'm just trying to figure out where do they find the time and where are they doing this? Is this at school? Because if you're at school 8 hours a day, I don't know. I hope I never walk in on that, but I'm sure it'll happen. But women aren't like that. So we don't think about sex probably as much when you don't have it. I feel like there's some switch in your brain that kind of just shuts off the desire. And it's like I used to call it convent mode. And it happened for me I dated long distance when I was in high school. And it was like when I was home with my boyfriend and we had sex, it was good. But then when I went away to boarding school, then it took like a month or so to wear off, and then it just kind of went away and I didn't miss it anymore. And same thing with college and kind of med school. I guess that happened in my marriage too, right? Like I just quit having it. And so it just kind of wore off for me. I have to look up the physiology behind that and see if that's a real thing. But so I was back. I was having good sex, and as a result wanted more and was more energized and was able to accomplish more, slept better, all those good things. So then in my practice, I added something called Diva, which was a vaginal laser. And it's by Cyton. It's a great device. It really, really works well. And I'd had it myself when I was, 6 weeks postpartum when I met Dr. Pete. I added that and started to treat some patients with that. And I think this was the pivotal moment where I kind of switched my brain from med spa. We did a lot of Botox and fillers and facial laser treatments and cool sculpting and all those sorts of things. And I love all that stuff. And I've changed a lot of people's skin and given a lot of people their confidence back. But I didn't really put a huge emphasis on the sexual wellness stuff. I did a lot of women in their 30s on bioidentical hormones. That was probably my biggest, 30s and 40s, and then some perimenopausal women and an occasional man. Usually it was the husband of one of my clients. But I wasn't doing tons of O shots, tons of Priapus shots, tons of pure sexual wellness stuff. That definitely wasn't the majority. And then I had a patient come in who was fit in her late 50s, and she's in the healthcare field. She's a nurse, and she was already a patient of mine for some of the skin treatments that we offered. And she'd been getting BioT, and I think I'd been treating her for maybe 6 months. And she bought a series of Diva laser treatments, and she bought an O shot. And I didn't know a whole lot at the time about her personal life. I knew she was married, but I didn't know a whole lot more than that. And she came in for her first laser treatment and her O shot, and I went to numb her. And she'd been to the gynecologist every year like a good girl. And she had just kind of told me that she hadn't had sex, and I think it was like a decade. And part of it was that there were some marital issues, and part of it was that the last probably 3 years or so, she said it was just not comfortable. It was to the point where she didn't even feel like she could masturbate because it was so uncomfortable. She said kind of like, my clitoris just seems like it's gone. And I went to put her numbing cream on, and I was kind of hurrying a little to my next patient. And so I just kind of like smeared it where I thought it should go, which is really should look exactly where it's going. And she sort of said like, oh, good luck finding it. And I took it kind of tongue in cheek, like, well, my husband can't find it, so, good luck to you. And I didn't think anything of it. I came back 20 minutes and so went to do a procedure and did like a proper exam on her. And her clitoris was completely gone. I couldn't even find it. It wasn't something I had seen before. And thankfully I had mentors, and her vaginal opening was really, really small. And like it was painful to put my index finger in. And she's like, I don't know what happened, and I think she felt bad. I think she felt like she wasn't taking care of herself down there. Even though she'd been seeing a doctor and whatever, maybe she felt like something happened because if you don't use it, you lose it, kind of with her husband. But it got to where it was painful. And there was a lot of pain there, not just physical pain, but mental pain. And so somehow we managed to get through her Diva treatment with that, with this dilator, which is not too big, but it wasn't comfortable for her and it wasn't fun for me because I knew I was hurting her. But I said, I can't do your O shot because I can't find your clitoris. And afterward, I asked her if it was okay if we snapped some photos with her phone. And I showed it to her because it was hard for her to see. And she just wept. And I called Dr. Pete and told him what I saw. And he said, that's lichen sclerosis. And I kind of knew what that was, but I hadn't seen it before. And it's an inflammatory condition that I'm not sure if it's autoimmune or what, but basically it causes this inflammation in women of the genital area. It can go all the way from like the labia minora, the majora, so the vulvar area, the vaginal opening, and all the way anywhere kind of down there. It can go around the anus and perianal areas, and it can itch or it can hurt or it can crack and it can bleed. And there's not a whole lot to do for it in the past. They kind of always just gave people these steroid creams, but they don't really work. And they tell you that you can't use them for too long because they can thin the tissue. And it's just devastating. Because when you have pain with sex, you have loneliness because you have somebody that doesn't even want to hold their partner's hand while watching a movie because they don't want to disappoint them. the person if they can't reciprocate. Or women can fake orgasm and they can fake interest and they can fake a lot of things, but it's really, really hard to fake pain, that you're not in pain, and have somebody not perceive that. Anyway, so I called up Dr. Pete and he told me that's lichen and this is what you should do. And he goes, do you still have the PRP? And I said, no, man, she's gone. He goes, well, when she comes back and you need to have her get a biopsy to make sure it's not, there's a vulvar cancer that can kind of look similar. And I didn't feel comfortable doing that in my office and she should see a gynecologist. So she made an appointment with a gynecologist and it was going to be like 2 months before she could get in. In the meantime, we started her on some cream, some steroid, testosterone cream and estrogen cream. And I did her diva. And she came back in a month and we injected some platelet-rich plasma. So kind of like I was going to do with the O shot, but I couldn't do the clitoral part. So platelet-rich plasma is your, it's like your blood spun down into growth factors. And it's sort of like the yellow goo under a scab when you skin your knee. And you know how when you skin your knee and then you get a scab and then like a week later, there's no scab and now you have skin again and you can feel nerves there. You know, you didn't lose your sensation. That's because it's basically the same thing. It recruits stem cells in to kind of grow new tissue. So I sort of injected all around the area and we did her diva. And I don't know, maybe like 2 weeks after that second treatment or 3 weeks after that second treatment, she texted me. And not that many people have my phone number. I'm really good with email, but she was one of the people that had it. And she said, I found my clitoris again. And with like an emoji. And I was so happy. And then I cried because it was really, really powerful to do that. And this something that her doctor didn't even notice or see. I don't know how you could have missed it. Maybe just didn't take the time. And so anyway, we did our third treatment. And that time I did some laser treatment externally to try to go through the sort of scar tissue and injected a whole bunch around. And we were able to do her O shot. And a couple weeks after the third treatment, she texted me and told me that she'd finally gotten in with her gynecologist and that there was nothing to biopsy, because it had basically completely gone into remission and the skin had normalized. And I don't know how long it was after that, maybe a couple months later. But she found a lover and she'd gone and gotten a tantric massage and found her sensuality back. And she came in and she had this necklace on and took me in her room. And this is a very, Christian woman and we're in Texas. We're in Austin, but we're still in Texas. And she's like, oh, you want to see my new jewelry? And she showed me her necklace and basically you could pull this thing out and it was a vibrator. And I'm like, you get it, girl. You get it. I was so happy for her. And then she showed me these bracelets, and these bracelets are these leather bands and they kind of had like a little chain that linked them together. And she's like, they're handcuffs. And, we have a very good friendship. Patient-doctor friendship, but a relationship. And she's, I don't know, a year and a half out from that treatment and having the best sex of her life. She just turned 60. And she tells me, I don't know, I could have a stroke tomorrow. I could have a heart attack. I want to enjoy this for as long as I can because I went so long without. And I think she was one of the main ones that made me say, okay, this is what I'm meant to do. All that other stuff's great and I'm still going to do that, but holy shit, somebody needs to help these people. And so I just sort of reshifted my focus, I guess, on, I wouldn't say marketing. I don't really sell to anybody, but what I was going to try to focus on. And somehow you just fake it till you make it. And you do a few people and start to get a little bit of a reputation. It's hard because people still don't talk about it, right? So I can tell her story, but I don't think she probably shares that story with her family or with, her friends or whatever. So that's my story to share. But getting the word out is really hard. And there are a lot of people who are suffering and they don't even want to tell their spouse, even if they're in a good marriage. So I'll talk about one more patient. I think she was the first female. And then this other guy, he was the first male, and that I really felt like I helped. And then sort of that was, where my focus went. He'd come in and he was in his early 50s, and he came in, he'd researched. The men are always very well researched. They've gone to my website. They've looked at pictures of my children. They know where I went to college. They know I was magna cum laude from Georgetown, more than the women. The women are more word of mouth, and the men are more, they're finding you at night at 2:00 in the morning when they're sitting up feeling worthless because they can't get an erection. And because we can tell where our web traffic comes from and what time it is. And their wives don't often know, was the case here. So he came in and he said, I'm interested in the Priapus shot, which is again like the orgasm shot or the O shot. It's your own blood, platelet-rich plasma that's spun down and it's injected. Dr. Reynolds invented that. But part of it is that you use a pump afterward. And part of it is that you have to put a needle in the penis. And it doesn't hurt, but you put a needle in somebody, there's a chance that they might bruise. And the pumps at the time I was using they plugged in. I didn't really trust people with the hand vacuum pumps and their vacuum erectile devices. And they help circulate the PRP. And they strengthen the muscles and things. So they're part of the procedure for 6 weeks. And he said, oh man, I really wish I could get this, but I can't because my wife didn't know and I can't have a bruise and I can't use the pump. And so what else you got? And I said, well, I don't know. I mean, I think that's really what I can do. And I listened to him, and he said, he'd been all over my website, and he said, oh no, how about that shockwave thing? How about that Gaines wave? You can do that. And I maybe heard of it a little bit, but not a lot. And he goes, you've got the machine, you already own it. And I looked up Gaines wave, and it's right. I mean, there's various machines you can use, but one of them is called the Zimmer Z wave, and we already had it because we were using it for cool sculpting. And he's like, I want you to do that for me because I learned about that, and I know that doesn't involve a pump, and it doesn't involve any needles. And I'm like, I don't know how to do that, man. And I didn't know that I wanted to spend more money learning how to do something. And I never going to hurt anybody intentionally. And so I thought, okay, I got to have a plan for this guy because he needs help, right? And his poor wife didn't even know that he was there. And this happens all the time with the men. Their wives don't know they're there. And they're not trying to sneak out and be with somebody else. They're just so embarrassed that they don't want to tell their wife. And I'm like, honey, she knows. Like, she knows something's not right. We're not stupid. But we are paranoid, a lot of women. And so if you're not having sex with her, she probably thinks you're having sex with your secretary or her sister or somebody. So you have to tell your wife. If you're in a committed relationship and you're trying to do something to improve your sexuality, that comes back on your partner too. And you have to tell them because it's the best way that things happen. Because if you don't, and you have guilt and shame, then even if anatomically we get things working, now you have this guilt or this secret or this shame. And then now you can have ED as with a psychological component to it. So that's my advice, is that you say it to your partner. And so he said, I'll be your guinea pig. And I was like, oh, I got to figure out what I'm doing then. So my husband and I, what do you do as a doctor, married to a doctor? You scour the literature. So we started looking through articles and found out that they'd been doing this in Europe for like 30 years. Again, France and the Germans and doing it. And they use the machine to send shockwave therapy. It's shockwaves. They're sound waves that go through the penile tissue in this case, and they clear out plaques that are there that happen with age. And then they also, it stimulates new blood vessel growth and new nerve growth. So more blood can flow through. So it's like having a wreck during rush hour and the traffic is slow, and it clears the wreck kind of immediately and then builds a couple new lanes on the highway. So you end up with more flow, which is what most ED is. It's a problem of flow. And so I'm like, I really want to help this guy, but I couldn't in good conscience charge him like full price because I was just going to wing it, enough to not hurt him, but not enough to know whether he was going to get an outcome. So I went to a conference and I asked the guy, Michael with Zimmer, if he knew any of the protocols or if he could get his hands on the protocols. And he kind of gave me some ideas of what I should do. So I just went home and sort of tried it. And somewhere in one of my treatments, he asked, he was a fluid engineer. And so he said, I'm thinking this would work even better if I was erect before treatment. He didn't say it like in a creepy way. I don't have any creepers. I've been really, really fortunate. I guess maybe the ER doctor and me can spot them. So they never make it. They never make it back into my clinic. But he said, well, so I can't use the pump at home, but can I use one here? And then I think it'll work better because sound travels better through fluid than it does through air. And who was I going to argue with, the frickin' engineer, right? I'm barely past physics. And I said, sure. So kind of experimented with that and did the treatment. And then he had some results, but wanted more. And this was a guy who also, like I said, he couldn't even masturbate. Like it was pretty bad. And he felt bad. And I felt bad because it's a really sad thing when your genitals don't do what you want them to, what your brain wants them to do. And so I went and decided just to eat the bullet and go down to Miami and get trained in Gaineswave. And I took my husband to get trained too, because I thought that men would be more comfortable with women. I mean, with a man doing their treatment than a woman, just like a lot of women prefer a female OB. I don't really care, but and anyway, so as it turns out, a lot of men actually prefer a female to do their treatment. So my phone started ringing, and I just started getting a lot of men in my waiting room for this new treatment, and they were getting results. And I guess I started to learn that I had one guy that he didn't even really get great results. He didn't expect results, but he had Parkinson's, and his wife didn't know. This is the common theme. It's mostly men in their 50s and 60s. The wives often don't know if they're married. And he would tell his wife that he was coming to a Parkinson's support group. And he would try to just touch her and she would be cold. And so clearly there was more going on than just the anatomy not working. And he sent me an email thanking me for doing everything that I could to try to help him through medication and through treatments and talking and encouraging him to talk to his wife and try to connect to her. And I just couldn't believe how grateful all these people were. And I mean, I got flowers, I got candy at Christmas, at Halloween, and it was just men that were really truly happy that somebody listened to them and somebody cared. And I take my time with people. I send everyone a handwritten thank you note, like in the mail with a stamp. And it was like the most rewarding thing for me. And I flashed back to Guatemala and thought, man, these people really love me and they love what I'm doing for them. And there's nobody else out here who's doing that and who's willing to help them. And I just kind of went for it. And that's where Austin Love Doctor came from. And I would love to help anybody else that wants me to help them in whatever way that I'm able. And if I don't think I can help you, I'll try to connect you with the person that can. So listen to my podcast and visit our website at austinlovedoctor.com.
Thank you for joining Dr. Emily Porter, the Austin Love Doctor. If you have a question about your relationship or sexuality, please feel free to contact her directly at austinlovedoctor.com.